So I wanted to talk with you about child welfare and what that looks like in the state of North Carolina. And in North Carolina, there's federal mandates that are handed down to the state, and then the state supervises all 100 counties, of which we're one. The federal government outlines those policies and those procedures and has the funding that they give to the states that's then passed down to the counties. At any given time, we're monitored by the state and the federal government, and currently Buncombe County is a volunteer of one of 10 counties to be voluntarily overseen by the federal government for part of the Child and Family Services Review. We volunteered for that when Mandy Stone was the Health and Human Services Director because we believe that it's important to constantly be looking at your policy and your practice and doing everything you can to improve that. The state also started doing something called process monitoring site visits, and that's when the division, the state, comes on site and reviews our case records, our data, talks with our staff, and we've had 3 of those site visits in the last year and a half. So what we are hearing from the state is that we're doing very well. Are we perfect? Are we meeting every benchmark exactly where we should be? The answer is no, but neither is anyone else, because child welfare is a constantly evolving and growing and changing practice, and we are working very hard to be as good as we can in every outcome that we're supposed to hit. Buncombe County years ago invested in an electronic database long before NC-FAST was going to be available, and in fact we don't go live with NC-FAST until January for Buncombe County, but we've had that electronic case management system in place for a very long time, and that allows us to track cases from the point of intake all the way through to case resolution. We utilize our planner evaluator, John Hudson, to help us track trends and data and be able to identify where there's areas that we need to focus on and areas where there are things that we might need to take a closer look at. The county also developed a quality assurance unit or team that is separate from social work. And that's important because there's a firewall between social work division and the quality assurance division, so that they're also reviewing our cases and our policy and our practice using the exact same instruments that the federal government and their state partners use. So we're able to do that internally, get that data, look at that data and trends, and just know where we need to focus our efforts in training and further education for our staff. So I'm going to as quickly as I can, go over an overview of what makes up child welfare in North Carolina. And I'm going to start by talking about intake. Intake is that point of entry for all of the information that comes into the child welfare system. And in North Carolina, the general statute says that every person is a mandated reporter to report suspected child abuse or neglect to their local DSS. So if you have any cause to suspect in North Carolina, you're required to report that to your local agency. When we receive that report with the allegations, we have to look at whether or not those allegations meet the statutory definitions of abuse, neglect, or dependency. And that's a 2-level decision, meaning that the social worker takes the information and then that's staffed with a supervisor who's looking at that legislative statutory definition to determine whether or not we have enough information to accept that report or not. When we get a report from a reporter, we ask them, do you want to know the outcome of your report? And this is unusual in that child welfare is very, very confidential, but a reporter can receive notification as to whether or not the report they made was accepted for investigation. And at the conclusion of the investigation or assessment, they get a letter that lets them know the resolution or the outcome of that case. Not confidential information, but the resolution of the case. If the case is accepted for investigation assessment, it's assigned to one of our Child Protective Services investigators assessors, and there's 2 tracks for that. There's the forensic track and then there's the assessment track. And the difference in those 2 tracks are the forensic track is for those abuse cases. Those are your shaken baby, sex abuse, broken bone type cases. Very severe domestic violence involving weapons would fall into that category. And then the neglect track, or the neglect allegations, go into our family assessment track. Both of those tracks have a time frame of 45 days, and our goal is to get in there and work with the family and figure out what's going on and make a decision within 45 days. The process of an investigation is really about information gathering. It's about looking at the family holistically. It's about having interviews face-to-face with the parents, the children, home visits to where the child lives, collateral contacts with people who might know information about the family, and how they operate day to day. We try not to be incident-focused, but holistically look at the family and how they cope with the stresses of their lives. At that point of initiation with the family, we're required to develop what's called a safety plan. So we're out there, we're investigating an initiation and looking at the family, talking to the children, talking to the parents, and we have to determine right then at that initiation, is the child safe? Can the child be safe with a plan, or is the child unsafe? And that plan is developed on the spot with the family, and it can change over the course of the investigation as we gather more information. And I'll talk a little bit about what that means. So safe means that when we're there and we're investigating and we're gathering information, we're not finding information that leads us to believe that there's a problem with the safety of that child in that home at that time. If we find information that leads us to believe the child is unsafe in that home, we work with the family to talk about what could we put in place so that the child could remain in the home safe with a plan. But there are situations where we decide that the family has a situation going on where the child is unsafe and cannot remain in that home. And I'll talk a little bit further about what that looks like. At the conclusion of that assessment or investigation, we have to make a decision, and again, this is a two-level decision between the worker and the supervisor as to whether or not there's enough information gathered that leads us to believe that the family needs ongoing involuntary services. So that's when we substantiate the case or find the case in need of services. If we decide that the family needs ongoing involuntary services, we transfer the case to our Family In-Home section. And our Family In-Home section is charged with working with that family to alleviate the risk or the harm or the safety issues that were identified during the investigation, and to work with the family to make sure that we put services in place that help that family to be healthy and the child to be safe in that home. We try to do that within 6 months of engagement with the family in the in-home family services case. And if we cannot be successful in keeping that child safe in that home, either because the parents are unwilling or unable, we might in fact take the case to court through juvenile petition without taking custody of the child and asking the court to become involved and order the parents to engage in services, or we may have to take custody at that point. The family is involved with creating the safety goals for themselves and the safety plans so that we are engaging them all along the way. It's their family. We want them to be engaged in developing of that plan. There are occasions where I mentioned earlier that we determine that the child is unsafe, and that can happen during the investigation, that can happen during the family in-home case. And at the point that the child is determined unsafe and we can't come up with another arrangement that keeps the child safe, then we do have to take custody of the child, and that is the legal term of when the child comes into the legal custody of the Department of Social Services, in this case, Buncombe County Health and Human Services. And I'm going to talk a little bit more about foster care and adoption as I go through the PowerPoint. I want to speak a little bit about our current census or our current population of foster children in Buncombe County. As of today, we had 347 children in care in Buncombe County. That is a significantly higher number than we have had in the past, and I'll talk about some reasons why in a minute. And we have 24 children that are in their ages 18 to 21 foster care. That happened in January when the legislature passed a new law that says we can expand foster care to include youth aging out of care from 18 to 21. It's a great thing. It's a great option for us. And we have 24 of those youth that are receiving foster care services through our agency at this time. I want to also point out in this chart that our two largest numbers of population of children in foster care right now are the ages of 0 to 2 and the ages of 6 to 12. And that's very concerning to us. What we also know is that over the past 2 years, of the children entering foster care, 70% of those children entered foster care because one or both parents had a substance abuse issue. So I mentioned that we use data and things like that to look at trends, and so we started noticing this trend of especially that 0 to 2 population increasing very, very quickly, and pulled together some community members and had lots of meetings and discussion about the crisis that we were seeing in the foster care system. And we're very fortunate to come up with some solutions that we think will help. So one of the phenomena that's happening, particularly with that 0 to 2 population, is newborns being born into the hospital and being born dependent on substances and testing positive for substances, and their moms testing positive for substances, and us trying to work to figure out how in the world are we going to address this. Because what we were seeing happening, we would respond to the hospital, the child would come into foster care, and then that mom would disappear. We would not be able to find her for 3, 4, 5 months, because if you're in active addiction, and the young lady talked about this earlier, if you're in active addiction, you're not focusing on what you need to be focusing on. And so we were losing touch with these moms, and so they were losing those critical bonding moments with their babies, those critical times where they were bonding with their infant, and they weren't engaging with us and to try to work towards getting their child back. And so very quickly they were losing all contact with their children. And I tell this story often where I'm in court, and Commissioner Frost was in court with me, and a mom shows up and is asking for visits with her baby that she hasn't seen in 9 months and is crying, and the judge is saying, "I'm sorry, we've had to move on." And that was just something that was unacceptable to us. So we got together as a community and started talking about what could we do differently. And these are some of the initiatives that we have in place in Buncombe County. And the first one is called the START model, and it stands for Sobriety, Treatment, and Recovery Teams. And this is really exciting. We have gotten technical assistance from the state of Kentucky, who has a START model there, and they have actually seen a 70% reduction in foster care numbers for children entering due to substance abuse because of this model. And so this is what it looks like. There are parent mentors with life experience, meaning they have substance abuse history, but they're now in sobriety, and they have child welfare experience. And they're teamed with a child welfare worker who engages with these parents very early in that investigation phase, where they go out with them and they talk to them, and they can come from a place of saying, "I know where you are, we can help you." The parents get assessments, and those parent mentors actually take them to the first 4 meetings that they go to. And that's all about engagement, and we know that that is the key to getting these folks engaged early and keeping them engaged. The other thing that we're very fortunate to have is prevention in Buncombe County. That is an unfunded mandate, and so the county actually funds 2 social workers to work in prevention. And those workers, because we have an MOU, a Memorandum of Understanding with Mayheck High Risk OB Clinic, are actually going over and engaging prenatally with moms who want to voluntarily work with DSS to plan for the birth of their child. That is unheard of. It is absolutely phenomenal. And these workers go talk to these women, because these women know they're going to deliver a baby that's going to be born positive for a substance. A CPS report is going to get made, and they know what's going to happen. So they're engaging with their prevention staff before the baby's delivered to come up with a plan. Who can help? Can grandma help? Can aunt help? Maybe they're engaged in treatment, and they want to be able to say, "Look, I'm engaged in treatment and I'm doing better," and they help gather those records. And so we're working very, very hard to provide that service to the moms who want to voluntarily engage with us. The other thing that we're doing is we have a co-located embedded child welfare worker on the mother-baby unit at Mission Hospital. And again, this is a collaboration between the county and Mission Hospital. She's an investigator, and she is passionate about this population. And she is on that floor, and she's the one that responds to these reports of these mothers delivering these infants. And how that is so different is it's one person who has great relationships with the nurses, the doctors, and she can go into the hospital room and engage with this family in a less traumatic way. And if they're not able to engage with her right then because they're upset, which anyone would be, she can walk away for 30 minutes and come back, because she's housed there at the hospital. She's also engaged in the community and knows lots and lots about the resources that are available to parents, and she's able to hook parents up to those resources in the hospital. And Finally, I want to talk about Abba's House. Western Carolina Rescue Ministries came to that meeting I talked about 2 years ago and heard my plea to help us be able to house these mothers and these babies in a way that creates bonding for them. And they are developing Abba's House, which is a 14-unit recovery housing model in their facility downtown. Jim and I were there last week. They're very close, and we're hoping it will open in January. And that will house 14 women and their infants. And I just can't tell you what a blessing that will be to this community, to be able to have those babies be with their parent in a safe environment while the mom's getting treatment and while we can make sure that baby is safe as well. I also want to talk about what child placement options are. So we have all of these children in care. Where are they placed? Where are they living? Well, there's a lot of options out there. And the first that we try with children that come into care is called kinship or relative care, because it's much easier and better for that child if they are staying with someone they know. So this could be a relative, this could be grandma, this could be aunt, this could be a friend of the family. The other type of placement is family foster care, and those are families who go through a licensure process, a background check, and become licensed foster families. We license foster families, and there are a variety of private child placing agencies that license foster families, and we use both. We use our own and other foster homes, depending on what the need is. And then there's residential care. And that is a licensed facility. And so there's congregate care, which would be something like Black Mountain Home for Children, Boy Hill Home for Children. And then there is congregate care that is more geared towards mental health placement, and that involves Via Health and our partners there when children qualify for a higher level of care. And then the last one is the biological parent trial home placement piece of this. So as we work with parents and as they do address their issues and we can move the children home with them, that's called a trial home placement. And so they're back living with their parents, and we're monitoring and trying to make sure that everything is going as well as possible. Another question that we get, and that you might have heard in the media last week, is, well, here's a kinship person or a relative, and why aren't you placing them with that person? When a child comes into the legal custody of the department, we are required to make sure that they are in a licensed placement. And if not, the court has to sanction the placement that we have the child in. And when you go to the court and they want to sanction the placement, they want to know about that person. And they want to know their criminal background of every adult living in the home, not just the person that's going to be the primary caregiver, but every adult in the home, their background, their criminal background. Do they have past child welfare history? Because that could be a concern. And is the home just environmentally at least minimally standard, so that meeting minimal standards so that the child is going to be safe and well cared for there? So sometimes when someone is saying, I'll be the placement, we can't recommend to the court that they be the placement because of something in their background that prevents that. And all of those have to be court sanctioned unless they're licensed. So when a child comes into care, we have to develop a permanent plan for that child. And remember, I mentioned that we have to achieve permanency within 12 months. That's a federal mandate. And 12 months is not a long time. It sounds like a long time, but it's not a long time. And so when children come into care, we have to assign a permanent plan to them. And the vast majority of the time, probably 99% of the time, the initial primary permanent plan is reunification, because we believe strongly that the best place for a child to be is with their own family if they can be there safely. And if they can't be with their own family through reunification, the next most permanent plan for that child is adoption. And we believe strongly that all children deserve a forever family, not a temporary placement, not a place to spend the night and lay their head, but a permanent family, a forever family. We work in tandem with our court system, our guardian ad litem program, which guardian ad litems are an independent third party appointed by the court, and their charge from the court is to make recommendations about what's in the best interest of the child. We meet with the parent bar, the court, the GAL quarterly to talk about data and trends and things that might be a barrier to timely, efficient use of the court system. I want to talk a little bit about the cost of foster care. There's been some comments made from this podium in public comment that somehow Buncombe County is getting rich off of foster care and adoption, and I really want to dispel that myth because it's just absolutely false. As you can see from this slide, and I don't normally read slides, but I'm going to actually read this slide directly. In fiscal year 18, there was $3.5 million budgeted to pay the monthly board payments. That's the payment that goes to the foster parent to help care for the child. And $1.74 million of that was reimbursed to the county by federal dollars. A little over $900,000 of that was reimbursed to the county by the state. But please note that over $900,000 of that budget is county dollars. We are not making money off of foster care. The second paragraph talks about that this county not only pays what we're required to pay to keep children in foster care through the foster care board payment, we supplement that to the tune of $630,000 for things like visitation. We provide visitation coaches so that families can get even more visits than we can possibly provide as just social work staff. Those kinship and relative care providers that might not be licensed and can't draw down this board payment, the county sometimes subsidizes that care by giving them direct money to help pay for that placement. And child care and medical care, not all those costs are covered by child care subsidy or Medicaid. And so when those costs are incurred, the county is paying for that. We are not making money off of foster care. Let's talk about adoption. That's another thing that you've heard, that we're somehow making money off of adoption. And again, that is simply untrue. Adoption assistance is a payment paid directly to the adoptive parents for children that are deemed eligible. Not every child is eligible for adoption assistance, but most children are, and here's why. Children that are adopted out of the foster care system have experienced trauma just by the nature of being in the foster care system and coming from a home where abuse or neglect has occurred. A lot of these children have extensive medical needs or mental health needs or educational needs that may qualify them to receive this adoption assistance payment. It is the exact same amount as the standard state foster care board payment. It is not an incentive to adopt. It is just another means of making sure these children have a permanent, forever home. In Buncombe County, we are currently paying for adoption assistance. We're contributing to over 500 children who are receiving adoption assistance. And you can see from this example for the month of October that our cost as a county, which is basically electronically drawn from the bank account of the county by the state every month, but for the month of October it was over $56,000. Our budget for that portion of our part of adoption assistance for this fiscal year is a little over $800,000. That's county money that's being paid to support adoption assistance. We are not making money off of adoptions. I want to talk a little bit about the Adoption Promotion Program. This is a program that the federal government, again, gives to the states, and I'm going to actually read this because I want to make sure that I get it exactly right. The purpose of the Adoption Promotion Program is to enhance and expand adoption programs, to secure permanent homes for hard-to-place children, and to encourage partnerships between public and private agencies to achieve permanency for children in a timely manner by providing incentives for the adoption of special needs children. Participating agencies are compensated for adoption services that culminate in the finalization of an adoption of a child from foster care. And this is what that money can pay for: recruitment of adoptive families, pre-adoption training, post-placement support, and the facilitation of legal procedures resulting in the finalization of an adoption. So yes, there are some incentives out there that if you are able to adopt children who are hard to adopt, older children, sibling groups, those type things, and we work jointly with a lot of our private child placing agencies, there is some money that is awarded for those adoptions, but it is restricted to use only for the recruitment and the placement of future adoptions. It's not money that we can spend any way that we want to. We are not making money off of adoptions. I'm happy to report that in fiscal year 17, we completed 64 adoptions in Buncombe County. Those are forever families for those children who had been affected and impacted by abuse and neglect. And last, I want to end by talking about what child welfare is. Child welfare is a balancing act with the safety and well-being of the child in the middle and the needs of the family on either side. And we are doing all we can to provide services to that family to address the issues that brought them to the attention of child welfare to hopefully prevent those children from ever entering foster care. And if they do, we're providing services to that family to try to reunify them because we absolutely believe that's the best outcome. But if that can't happen, we are going to move towards a permanent plan for that child because it is about the child having a permanent plan and a forever family. The issues driving child welfare in Buncombe County right now are the issues that you've had before you in many, many venues: the substance abuse, particularly the opioid crisis, and domestic violence. Those two issues on their own are incredibly challenging to tackle, as you know. But when you add into that mix the impact of those issues on children who are exposed to substance abusing parents and parents who are engaging in domestic violence, you can see how challenging the work of child welfare is when you're trying to balance all of that, make sure the child's safe, and provide services to the family. But here's the positive. We believe change can occur. We believe families can heal and children can be reunified with their parents safely. And we believe that if that's not possible, children can have a permanent, forever home through adoption. We know that no system is perfect, and we do not claim to be. But we know that our staff work every single day to provide the absolute best services that they can to the children and families of Buncombe County. Thank you, and I'm happy to answer any questions.
Thank you for doing this. I can't even put into words the feelings I get when people accuse people on the front lines of protecting children that they have an agenda or they're making money. And so for that, I'm sorry you had to go through this explanation, but I think it was really informative.
That was very good.
And I appreciate you doing that, and we value what you all do and the struggles and what you have to face every day. And it's something that very few people could do as competently as Buncombe County does.
Thank you, Commissioner.
Doesn't look like there's any other questions, so thank you for that very thorough and very informative presentation, and for all of the work that you and your staff do for kids and families in Buncombe County.